Hi, my name is Hannah Butler, and I'm going to present to you a comprehensive strategic and marketing plan that will explore the expansion of the psychiatric emergency room at Bentob Hospital. Bentob Hospital is one of the two Level 1 trauma centers in Houston. They are both located within the Texas Medical Center. Bentob Hospital is a 75-bed emergency department, as well as a 12-bed locked psychiatric emergency department. Approximately 8% of all EC patients are seen for psych complaints with an average length of stay of 10 hours. At any given time, there can be 20 to 40% of the beds in the department occupied with psych patients. Harris County has an approximate population of 4.7 million, with a median income of $62,000 and a 23% uninsured rate. Approximately 15% of Harris County residents are at or below the poverty line. This is the nursing professional practice model that is used by Harris Health System. It is made up of 3 pillars. This project being presented applies to the pillars, or the foundation, if you will, of the Harris Health System. By its alignment of the unit expansion to its mission, vision, and values, which we'll explore a little more shortly, and the impact on nursing practice and the expected changes in quality outcomes. The strategic plan has 3 main goals. One would be to repurpose the non-patient care space, to expand the emergency psychiatric area, and to increase throughput. We will now talk a little more in depth about the strategic plan. During year 1, the expansion of the 12-bed unit will begin. It would be turned into a 25-bed locked psychiatric unit. It will require repurposing of non-patient care spaces. The current users of this space will be moved to a new area, and a period of 2 weeks will be allotted for this transition. The construction phase will take the full 1 year. However, beginning at month 11, the new staff will be trained to allow for a month of training in order to ensure that those staff are fully trained by the time that the unit is opened in full. There will be 1 additional psych tech and 2 additional nurses needed to staff the area to capacity. During year 2 is when we would expect to open the additional 13 beds. At that point, it would be evaluated to determine if an additional provider is needed to offset the workload. If it's determined that that provider is needed, they will be staffing from 11 a.m. to 11 p.m. as that is the busiest portion of the day. During year 3, the unit will have been functioning at full capacity for a full year. The EC Psych area that is now the 25-bed unit will be expected to see an increase from 1 patient per bed per day to 2 patients per bed per day. The main EC should allow for increased throughput, so you would expect 3 patients per bed per day for those regained bed spaces. The 3 main goals with the marketing plan would be to 1, post the positions needed to be filled, promote the expansion of the new area, and increase the insured payers. So position promotion will begin at the 11-month mark. The marketing for the positions will take place via email to internal and external email addresses. This email will also promote the existing referral bonuses of $1,000 for nurses, $500 for techs, and $2,000 for providers. The responsible parties for this would be HR and leadership from both Baylor College of Medicine and the Psychiatric Emergency Center. Promotion of the expanded unit will occur by way of a 30-second televised commercial, which will be broadcast beginning 2 weeks prior to the opening of the expanded unit and continue for the next 5 weeks. This commercial would expected to be televised every other day for a total of 30 times and will cost about $7,500, and media relations would be in charge of this promotion. We would appeal to insured payers by the broadcasted commercials, as well as target those insured payers buy printed brochures, which will be distributed at local psychiatric clinics at a cost of $750. And corporate communications and language services would be needed for this. The language services would be to help translate those printed materials into Spanish and Vietnamese, which are our two most common languages outside of English. This graph will show you the expected volume and revenue projections for the first 3 years of implementation of this expanded unit. As you can see, construction will begin at the beginning of year 1 and remain ongoing until the beginning of year 2. Therefore, the revenue for this period is going to be 0. However, since the new staff, the 2 nurses and 1 tech, will be hired at month 11 of year 1, you do have a deficit of approximately $57,000 due to the payout of these newly hired staff. However, the benefits in the coming years will be that you'll be able to open the unit to full capacity as soon as the construction is finished. There is projection for revenue and volume for years 2 and 3. However, you can see that there is varied revenue based on the need for an additional provider. However, you can see both possibilities represented in this graph. We will now take the time to review some of the expected outcomes with this expansion. We would expect to increase the safety and patient satisfaction as well as the revenue and meet the community's needs. With the benefit of added care spaces, the EC would be able to provide care to a larger number of patients. This should in turn increase the throughput, resulting in a higher patient satisfaction score due to decreased wait times and a higher quality of care, among other things. Many research studies, including those conducted by Chang and Price et al., have found that overcrowding in emergency rooms decreases the quality of care. There is also an increased risk to patient safety. Mortality rates are typically higher, and patient satisfaction scores are lower. With improved performance and quality outcomes related to this expansion, the organization will have the opportunity to capitalize on value-based purchasing. Bentab is the only public psychiatric facility with emergency services, therefore the community is in need of these services. This is directly in line with Harris Health System's mission. In part, the mission of Harris Health System is aimed at serving the needs and improving the health of those in the most need in Harris County. Harris Health Systems has made a promise to its patients that the system is committed to responding to the needs of the patient, the community, and family. Based on the growing volume of psychiatric patients that present to the emergency room on a daily basis, it has been determined that there is a need in the community, and this expansion will help to serve those in need. These are the references for this presentation. Thank you for taking the time to listen to this, and I hope that you have